I'm Leslie Shanks. I'm a family doctor and now working as medical director of the MSF section based in Amsterdam. In general? I started off working with MSF in 1994, and I then intervened in the war in former Yugoslavia and in Bosnia, and also responded in the cholera outbreak that followed the genocide in Rwanda. It's a year. Since then I've gone a bit back and forth with MSF because I find it important to keep my clinical practice up in Canada. So I have been a field worker. Last time working in the field was 3 years ago when I was a medical coordinator of programs in the Democratic Republic of Congo. And then in 2007, I, for the first time, worked in headquarters. So now I'm based in Amsterdam, and am working there to oversee the programs that MSF is running out of Amsterdam. And it's really, it's a very interesting job. I have to say it's the only job I've ever had where I've never been bored. I have no idea what I'm going to do when I go in that day. It's really the interesting stuff that I get to deal with, the things that are difficult, the new things, the new emergencies that are going on, and so I feel very lucky to have a job like this. I think some of the challenges when I'm working in the field certainly are very often problems of access to get to the people that need our assistance. That becomes more and more difficult over time, particularly with this blurring of the military humanitarian space. So very often it's just actually reaching the people who need our assistance. And then it's working in healthcare in a resource-limited setting. So we don't have all the tools that we're used to using at home. We have to adapt very often the approaches and that we've learned in our clinical medicine, and make it work in the settings that we're working in, and that's really a challenge. It's also why operational research and documenting our experience and our outcomes is so important now within MSF. Yeah, I think some of the personal challenges is really just the limits of what you can do in that setting. It's just seeing a child that you know, if you had that child at home in that delivery room, you'd be able to resuscitate that child, you would be able to save it, and just not having what you needed to make the difference for that child's life. And I think that's really, that's really difficult. Most of the time you're not intervening in these large-scale emergencies, but when you do, then it's really dealing with often the scale of the disaster, and it's like nothing that I can compare to at home. And it's all of the patients are real, there are people to you there, but sometimes the enormity of that is just very difficult to cope with in those very, very big emergencies. You know, I've been reflecting on that and whether or not I feel it's changed. I don't think so. I knew what I was getting into. I knew that I was making the choice for an emergency relief organization. I was not making the choice for working in development. That has been the case with MSF. I think the work, as always, turns out to be much more complex. Complex in terms of the political situation, in terms of the conflicts we're intervening in, more complex in terms of what we're doing medically as we're dealing with emerging infections, drug resistance, etc. But that core of intervening when people need your help the most, that's the same as when I started out.